Hey, everybody, it's Kevin Henry, editor-in-chief for drbicuspid.com. Thanks so much for joining us for another episode of the podcast. Thrilled to welcome back Dr. Ankur Gupta. Dr. Gupta, how are you, my friend?
Great, Kevin. Thanks for having me.
Hey, good to have you back. I always enjoy hearing your thoughts on various products that have earned the Catapult vote of confidence. And today we're going to talk about the DIAGNOcam from KaVo. Before we dive into that, though, I always love for our audience, if they haven't met you yet, just to tell a little bit about you, if you don't mind.
Sure. My name is Ankur. I've been a dentist for like 24 years, 22 years, something like that. I have always found dentistry to be than I kind of had expected. I first got out of school, I kind of thought that there would be a progression that was linear. And that's probably been the case for certain things, but for other things, it just, dentistry has remained kind of difficult. And so it's kind of been my mission for the last 10, 15 years to really attack the most things that make it easier and make it more predictable and make it less stressful. And that's been kind of my for the last 10 years is just to let other dentists know what I've discovered on that journey.
So tell me how the DiagnoCam from KaVo fits into that, though.
Yeah. Okay. So let me explain what it is first. So
Yeah.
it looks at first like a very fancy intraoral camera. And that is actually one of its features. I mean, it's a really nice HD intraoral camera, which is great, and which I find helpful as an educator, because if I want to take a really nice close-up photo, camera does that. But what makes it unique, I mean, there's a million high-quality intraoral cameras that are out there. What makes the DiagnoCam unique is that it has certain features that make dental pathology very easy to see. The one that I was most enthralled with was it has a transillumination feature where the camera is still pointing at the occlusal surface of a tooth, but it has light shining through the interproximal. And what that does, and this is a really, really high intensity light, what it does is it will make the unaffected enamel look translucent, and it'll make any decay look like that decay is dark. And so what you end up with is you're able to see interproximal lesions totally different than the way you would see interproximal lesions, either from a clinical exam or from by way X-ray. You can see the extent, the location, and that is really unique. Like I've never been able to see that before in a couple decades of being a dentist.
And I mean, dumb question here, but how does that help you as a dentist seeing that?
Okay. All right. So there's two things. Number one is a bi-wing X-ray will give me one view of how much enamel and how much of the underlying dentin is affected by decay. And it's black and white and lots of gray. And it's very difficult to really know with any degree of confidence how much of that decay is extended into the dentin. Okay. The reason why that's a problem is because if I'm going to drill on that sucker, I need to be sure that there's a good reason for me to drill on it. Okay. And so when there's decay that looks really obvious in the enamel, I don't want to drill out enamel decay. There's too many products that are out there that we can use to prevent decay from progressing and potentially get it to remineralize in the enamel and reverse the decay process. I want to use products like that because that way I'm saving that patient the possibility their tooth getting drilled on. This, because it provides us a completely different angle of the extent of the decay, I'm able to use that as my justification for either using a preventative product like Curadon or silver dynamite, or if I can see through the transillumination that the decay is extended into the dentin, then I can say, okay, that's option number one. The other thing too is that bi-wings never show us the location of the decay, buccal or lingually. Okay, now that's important because the rule in dentistry, the rule for drilling class 2 lesion is you got to open up the whole freaking contact. That's by opening up the whole contact and finding out where the decay is. Sometimes the decay is so small, it's so incredibly, it's so invasive and destructive to drill out all of that enamel when really there was just a little bit of decay, maybe on the lingual part. I can't see that with a bite wing. All I know is that there's decay on the bite wing, and I just got to pulverize a ton of enamel and find it. This allows us to be so much more precise. And by being precise, we get to actually retain a lot of that enamel that we would have otherwise had to drill out. And I wanted to say something about enamel here. Enamel is like, it's like, if you think about enamel, it's like a blessing. Like how our bodies are all just super squishy and soft. And that's kind of the human body. I mean, we're soft everywhere. And then we have these things emerging from our gums that are like harder than, like hard as diamonds. How the heck did we do, like, how were we created that way?
Yeah.
And I think because we're dentists and we were trained to use a drill and trained to just friggin' take a drill bit and pulverize all that enamel. I think we kind of lost sight of how special enamel is. I kind of feel like, damn, I have maybe, I don't know, 10, 15 more years of being a dentist. I want to retain as much enamel as possible in those 10 to 15 years and actually have that all.
I love that. It's a great reminder. I mean, honestly, we go through our everyday, and I think sometimes we lose track of the things that are truly important, like enamel. I mean, I think that's a great point. Absolutely.
Yeah. And the other thing too is I'm even better than that. Let me do everything I can to not drill at all. And
Yeah.
there's so many nice preventative products out there that are showing really, really great promise. I like to think of it like this. My daughter is 17. When she got her license at age 16, she started going to Starbucks and she started getting like high sugar coffee. And this girl who never had a cat in years of life, she comes to my dental office, gets her bite wing, and we see, I don't know, 7 incipient lesions in the enamel. And there was a time in my career, and I think a lot of dentists who are listening to this know, there was a time in our training or a time in our, I have to do 7 cavities on them, 7 fillings. And they were all been class 2 lesions where we drilled out a ton of enamel. Think about you to do a class 2 composite on somebody when they're 17. What's that class 2 going to look like when they're 35?
Yeah.
Let's face it. I mean, even if you did everything right, there's a chance that class 2 is going to look a little dingy at age 35 and either need to be redone or a crown needs to be done on it, or endo and a crown needs to be done on it. Okay? Age 35, 40. Now this person has a handful of endo and crowns in their mouth. Now fast forward to age 65. What's happened? There's crowns with recurrent decay at the margin. There's endos that have failed. And now we're talking about pulling the teeth and doing implants. So now, age 65, you see a lot of patients who have a couple of implants, some endos and crowns, some crowns, whatever. Now, what about the implants that have periimplantitis? They have more teeth that are failing, and that patient is going to have more dental issues. And I kind of feel like, that's been dentistry forever. That
Yeah.
has been dentistry. What if we just slow down that process? And when they're 16, 17, we say, let me just make you some reaming trays on these lesions. Patient's going to be 30. And what we've done is we pushed all of that timeline further down. And I feel like something like that, a DIAGNOcam by KaVo, that allows us to do this type of dentistry, like this dentistry 2.0, this preventative version of this job that we want.
Love it. I mean, that's so well said. And last question I want to ask you was just your thoughts on the image quality from this and how that's helped you as well.
Okay, let's just talk about intraoral cameras in general. They're fabulous. I mean, intraoral cameras allow patients to feel emotionally connected to their dental situation, right? Because you take a photo of some filling that's looking dingy, that patient is going to be like, okay, I know I got to do such incredible resolution. It just makes it easier to have these.
Well, I love the insight, and I did not expect to go down this road today, but I love that you shared that, and I think that resonated with a lot of our listeners. So if somebody has questions or they want to follow up with you more, how's a good way to do that, my friend?
So my website as an educator is Be Better Seminar, Bebetter, like being a better person, BeBetterSeminar.com.
Yep.
And then my Instagram handle is just my full name with DES at the end. So at Ankur Gupta DES. It's probably the easiest ways to reach out.
Awesome. Well, this is in the middle of Dr. Gupta's article, so you're going to learn a lot about DiagnoCam in here, but we always love talking to the author and getting a view behind the scenes, I should say. And I'm so glad we did today. So thanks for your time, my friend. I appreciate it.
Yeah, it's always wonderful connecting with you, Kevin. Take care, okay?
Same. And thanks to all of you for listening to this episode of the drbicuspid.com podcast. We'll be back soon with another podcast and another product that's going to make a difference in your practice.